Very good morning. Today I'll talk with you about the applied and surface anatomy of the muscles of the forearm and hands. The muscle of the forearm we have this is here from the common flexor tendon here. We have four muscles in the first layer. This is the flexor carpi ulnaris, and then the palmaris longus, then the flexor carpi radialis, and then the poronator teres for poronation here. If we remove them from here, we have the flexor digitorum superficialis, underneath it, flexor digitorum profundus. If we remove all of these, we have two muscles here still in the front part of the forearm. The flexor pollicis longus from here, and also the poronator quadratus for poronation of the forearm. In the back of my forearm, we have the following muscles that originate from common extensor tendon. This is the lateral epicondyle of the humerus here. First, we have this is we call it the brachioradialis for supination and poronation for the position. Then this muscle is extensor digitorum, tensor carpi radialis longus, and this is extensor carpi radialis brevis for radial deviation. And then we have the extensor digitorum for extension of the wrist and fingers, and then the extensor digiti minimi, and then extensor carpi ulnaris, and finally the anconeus here for extension of the wrist. If we remove this layer of the muscle, we find underneath of it the supinator for supination of the forearm. If we remove these muscles, we will find now only four muscles here at the back of my forearm. We have this is extensor abductor here. We have here the abductor pollicis longus, and beside it the extensor pollicis brevis, and this tendon for extensor pollicis longus. This we call it snap box, and here is extensor indicis in this one. Now we will talk about the muscles of the hand. We have the thenar eminence here. We have three muscles. Here is from this side we have opponent's pollicis here, and here this is the abductor pollicis brevis, and here is the flexor pollicis brevis. Okay, for the thenar eminence here we have four muscles. Here palmaris brevis, we have here the abductor digiti minimi, and then the flexor digiti minimi here, and from here is the opponent's digiti minimi. If we remove these muscles, the rest of our muscles, we have the lumbricals. What is the lumbricals? The muscle which make flexion of the metacarpophalangeal joint and extension of the interphalangeal joint, distal and proximal. These muscles, these four muscles of lumbricals muscle, all of them are inserted on the side of the first phalanx here, and they originate from the carpal bones from the lateral side and the thumb side here. Okay, if we remove this lumbrical muscle, the rest of the muscle of the hand, we have muscles for abducting the finger and flexing and adducting the finger. When I mean abduction, so the fingers will be away from the middle finger, and with adduction it will be come to the direction of the middle finger. For the abduction of all of my finger, we said here we have abductor digiti minimi, and abductor pollicis longus, and abductor pollicis brevis. So this is for the thumb and little finger. We have here interossei muscle. We have here dorsal interosseous muscle, and we have here palmar interossei. The dorsal interossei we have four between the five metacarpals. This is the first interossei, second dorsal interossei, third and fourth. This is four interossei. For abduction, for these three fingers only. This one, the first one, dorsal interossei, for the third, for the index to make abduction and insert it over here. And for the ring finger, the lateral one, or the fourth one, for abducting the ring finger. For the middle finger, we have two dorsal interossei that could move the fingers or middle finger in the both direction. Okay? Here, from the palm, we have the finger for adduction of the fingers. We have here for the thumb, we have here what muscles we call it adductor pollicis. The adductor pollicis originate from the third metacarpal here to the thumb to make an adduction. And then we have three main palmar interossei. But these three palmar interossei it adapt the little finger, adapt the ring finger, adapt the index. So it inserted here in the middle part here, and in this part here, and this part here, to allow all of these fingers to be adapted like that. The middle finger doesn't have any insertion for palmar interossei, and the palmar interossei originate also from the metacarpals over here. These are the muscles of the forearm and hands.